behalf of RMA Toronto, it's my great pleasure to introduce you to Dr. Jeevan Perera. He's been with NASA for over 30 years now. He's currently working on advanced countermeasure software to mitigate human health risks for future manned exploration missions. He's had plenty of assignments over the years, technical and leadership assignments in risk management over several of the manned space programs, including the International Space Station, the Orion spacecraft. Early years, he even focused on some of the software development that was required for the backup software for the space shuttle. So we're talking about someone who has been there, done that when it comes to space travel and anything to do with NASA. So it's with great pleasure to introduce Jeevan to us to talk about what you guys have been doing with risk management.
Yeah, thank you for that introduction, Bruce, and thanks for the invitation. Welcome, everyone. I guess most of you are in Toronto. I'm in Houston. I wanted to start off the presentation just to clarify that the responses related to the COVID operations there at NASA is definitely not one of my focus areas. And so this is just through research. I have worked, as Bruce mentioned, several different key risk manager positions within NASA. And so this kind of mixes both the COVID and how we're dealing with the risk side of it. And obviously these are all my opinions and don't necessarily represent what NASA's positions, strategies, or plans are. So let's get started. I didn't want to spend too much time. Generally, the structure of this presentation is going to be for 15, 20 minutes, and then open it up for Q&A. I think we've got about 40 minutes total. Hopefully at one point in the future, when things are back to normal and you guys have your event, I'd like to come out there and give a more comprehensive risk management talk about how we identify and manage risks, globally across our missions and objectives. Well, anyway, starting with the COVID background, I'm sure a lot of you are familiar with this, so I'll just touch on it very lightly. So it is a form of SARS, and it is unlike any other virus or form of that SARS that we've dealt with. And so it has been more problematic, I guess, addressing the remediation and the prevention and the mitigation efforts globally. It is believed that it spread from animals to humans, and probably in the late 2019 timeframe in Wuhan. I guess there's still speculation, research to really isolate how and where that transmission occurred. But anyway, back in March, as everyone knows, World Health Organization identified and declared that COVID-19 was a worldwide pandemic. And I think the province within China was able to contain fairly well with really aggressive measures, but not quick enough to prevent it from migrating from that initial outbreak region, and it's slowly and steadily spread throughout the world, and we are actually on our second wave of infection, and there may be more waves coming till, obviously there's a vaccine that's created and better therapeutics. Currently, when I looked at it this morning, some of the sources were saying that there's about 14.7 million confirmed cases, and probably the actual cases are very much larger than that. And confirmed deaths, I think currently sit at about 610,000 worldwide. The virus itself definitely causes respiratory illness and infection, and so it can create lots of issues for certain types of people, especially those that have compromised immunity or respiratory issues previously. The highest risk populations from research I did, obviously it's older people, so generally 65 and older, and those that are living communally, so at nursing homes and other long-term care facilities where there's a fair amount of interaction with other residents and then staff. Um, there's also those that have underlying health conditions such as diabetes, heart disease, lung disease, obesity. So other factors that can affect the respiratory system can create, different outcomes with different people. I think I've read that there's other factors from blood type and other factors that might affect if you get it and how bad of a case that you do get. It's still unclear what the best therapeutic and preventive medications are, and obviously there's lots of research and testing that's ongoing. I know there was press releases recently from some pharmaceutical companies that had promising results, but at least in the U.S. with the Federal Drug Administration, it probably is still 9 months to 12 months off till a approved vaccine is deployed here. I'm sure Canada might be somewhat similar. To the next page. So just going on to the NASA framework of how we're addressing um, and mitigating the risk of COVID. We've established 4 stages, and we're currently on stage 3, and obviously we can go up and down on our assessment of what stage we are and what countermeasures we're putting in place to address the current state. We have gone up to stage 4, but currently at stage 3. I'll go ahead and kind of outline the stages. Stage 1 is kind of a minimal threat stage. We would allow all employees, free access with the proper protocols to come on site and work as normal to the most extent. But there would definitely be, teleworking capabilities that are promoted. So for your individual circumstances or your individual preferences or comfort level, we would provide the ability for you to telework the majority of your time. Obviously, social distancing and the other kinds of preventative measures would still be fully implemented, and travel and interaction outside of your home office is also limited, except for mission critical and support missions, or current missions or even future missions that are on predefined schedules. Stage 2 is it's a little bit more restrictive. It only allows mission essential work, mission critical work to be performed on site. And so there is approval process vetting of those individuals that need to come on site for whatever reason before they're permitted. And then all the visitors, foreign space agencies, contractors, and others that need to get on site. Obviously, those are also going to be somewhat limited. We do have fitness centers and other kind of employee programs on site, and so at that point, even stage 2, we would keep the fitness centers closed. Interactions with the clinic on site, which is kind of like a hospital staffed by flight surgeons and MDs and nurses for occupational reasons and for flight reasons. Those clinics would defer the annual physicals that employees get to ensure that their health is maintained. And a little bit more on protocols and adherence to the protection between employees to limit the spread. Stage 3, the one that we're in, is mandatory telework, and there's even less availability or options to come on site. So it really has to match to a specific mission essential requirement for you to come on to support an active mission through, support in the Mission Control Center, or getting the crews ready or getting systems ready for flight. And those are only workers that would be permitted to come on site. There are some food services that are provided because it's a big campus, almost like a college campus, and so fairly large. And so we do have cafeterias and food services and other support services. Those facilities and options are on a limited basis. Obviously, we have a daycare on site also, which would still remain closed. Stage 4 is really the worst level, and those level of restriction is where it really needs to protect either crew on orbit, directly supporting the mission. The criteria to get on site is very more restrictive. And for the most part, all the facilities, all the offices, all the labs, unless they're directly supporting, mission critical to protect life and critical infrastructure, they're going to be closed, and all travel would be suspended. Any questions about the way that we categorize these 4 stages? Obviously, stage 0 is normal operations, which I'm not sure when we'll ever get to. It definitely looks like the next wave would come sometime in the fall. So let me go through some of the risk mitigation efforts that we've implemented to address the pandemic. First and foremost, for the employees, training, education, and outreach, helplines, resources online, resources that are through the CDC and other sources to help with their own mitigation efforts individually, with their families, for when they need to come on site, if there were questions or issues. Definitely try to get everyone aware of what it is and how best they can interact in the current environment. For the most part, there hasn't been a lot of financial impact because most will work either on-site in those limited capacities or through teleworking. So there have been no financial impacts, but there are certain contractors, for example, like the cleaning crews that come in and clean the offices and the labs. Obviously, we're not having to do that. And I'm not fully aware of how they've been able to limit their financial impact, but for those that have impacts, there are mechanisms and processes to allow for that financial assistance. Obviously, counseling and mental health support would be vital for those that are just having to deal with changes and impacts throughout their life, and for those that might be infected or know those that have been affected, whether within a family or external. A lot of the organizations and offices have been trying to set up virtual social interactions. I know Bruce and I were talking about how maybe that's one element, we've adjusted well to this new norm, but the fact that you don't interact with your colleagues does have impacts. And so virtual social hours, besides the standard meetings, those other kinds of interactions that you have with colleagues, trying to promote those to the best of our abilities. Doing a lot of surveys with employees to gauge how they're doing, where they see deficiencies, where they see improvements, address their concerns and constraints, whether it's work schedules or other things. How best can we operate under this new environment? We were fortunate in that we were implementing the virtual work environment before the pandemic. We were rolling out Microsoft Teams. I know you guys might be using WebEx a lot. There's also Zoom and many other applications for allowing employees to interact, or individuals to interact in a virtual environment versus physical. And the use of Teams is just exponentially grown within NASA. It does allow for documented meetings, assigning actions, archiving common documents or resources. So it actually, for me personally, has been, I think I've been, for the most part, as productive as if I was in there physically in the meetings. Obviously, for the work that I do, I need access to hardware development systems, and so those limited purposes are when I go in. But again, I probably could operate in this new environment for a sustained period of time just because of the infrastructure that's built up around teleworking. There has been, restructuring and reprioritization, mission critical work. So for those, projects and missions that can be stretched out and don't have substantial cost or other impacts, the project managers or program managers are working to see how those can be accommodated with minimal impacts. And obviously, I think I touched on this topic before, that travel has been significantly limited. Everything's been gone to virtual anyway, and the only travel that's permitted is, supporting specific tests that support, flights or missions that are ongoing right now. When those individuals that they do have to come on site, there are enhanced protocols that are implemented from checks, a lot of pre-visit questionnaires to ensure that the individuals don't have symptoms themselves, have not traveled extensively to infected areas, have had contact with COVID patients, and there are quarantine requirements if they need any of those. Obviously, gloves, masks, and goggles are used for the on-site time to ensure that we limit the spread of the virus. The 6-foot social distancing that's mandated. Obviously there's exceptions when you're working on hardware, when you need 2 people working in the same place. And so there's other protocols like masks and gloves help mitigate the threat that's there. A lot of the work plans for activities that are done, whether they're meetings or actual hardware development, hardware testing, they have been revised to ensure that all those protocols that I just discussed are included in how people interact. There's a lot of time spent in cleaning and disinfecting the work areas before the visit and before the actual work activities start, and then at the end of the work activities, so that there's always a clean before and after, also to minimize the threat. Obviously, when individuals are infected or come in contact with those infected, we ensure that privacy is maintained. So the information is disseminated, just not the details of who is infected, unless there's contact tracing going on. They do encourage testing individuals. I think there are accommodations for testing on site for those that critically need it. Otherwise, here in the U.S., I think the CARE Act ensures that anyone in the U.S. can get the test for free, even if they have insurance. So, and I know here testing has become more accessible. Sometimes you still have to wait 2 or 3 days to actually get the appointment for the test. And it can vary from 2 to 3 days after the test up to about 6 days to actually get your results back. One other area that I would stress to you guys we've been focused on is updating our business continuity and contingency plans because it is still unknown where the end is and what the impact of those ends are. And so all the contingency plans and continuity plans that you've developed and have implemented, you definitely want to start revisiting those and updating those as the situation changes and uncertainty of what the final outcome is. You definitely don't want to be in a reactive mode when things shift and you're not ready for those shifts. One of the things that may not be as applicable to NASA, but maybe for other business organizations, is this new environment does create new business opportunities. And so even though there are a lot of negatives, if you think through your business plans and figure out, are there areas, untapped areas that you can leverage under the current environment so that at least you can mitigate some of the harm by supplementing with some of the advantages that you might be able to achieve under the current environments. We do have a set of recommendations that we've given for employees at home during their interactions outside of work to help with them individually, but also to minimize the threat when they do come on site. Most of these guidances, I think you're probably familiar with, and I will somehow get it to Bruce, the slides you can post to this meeting so that they would have this reference material if they need it later. Is that right, Bruce? Is there a way if I get you these notes?
Sure thing. Yep.
I know I've run more than 15-20 that I initially wanted to set aside for the talk itself. I know it's a very high level view of our risk mitigation efforts. I thought the most advantageous part of this would be the Q&A, individual questions that you might have related to your own organization or what I outlined here. So with that, I'll open it or turn it over to Bruce to moderate the questions.
Yeah, so what we'll do with questions is if you have a question, please ping on chat that you want to ask a question, and then I'll call you up individually. And so that way we get a little bit of a order into the question time. But I might kick it off first, Jeevan. I'm just wondering, how do you guys coordinate internationally? As in, say we travel up to the International Space Station or various other international joint activities that you do. Is there a common set of standards? Is there with this medical situation that we've got here?
Yeah. So up till the recent SpaceX Crew Dragon mission that took the 2 astronauts, I think it was in early June, memory's failing, not only the eyesight. All flights to the station and back were through the Russian Soyuz capsule. So it didn't matter where you were from, NASA, ESA, the Japanese, and others that were flying up to the station, they went up on the same vehicle. And so there was common protocols. They launched out of Kazakhstan. And so obviously this common protocol, since they're all traveling together up to the station and then back down. Crews are, I think, isolated. I know the SpaceX crew was isolated since March. Very little contact with anyone pre-mission, because the worst case would be as if one of the crew members were infected and then infected the whole crew on board the station. They are medical personnel, and I know they coordinate well for crew purposes. They coordination of the health and maintenance of the astronaut health and the cosmonauts. Unfortunately, I don't know all of the details of how they ensure that, since they're all going to the same place, the station, that they're protected equally no matter where they came from. many of you may know, the International Space Station is comprised of 16 different nations that came together to design, build, and operate. First modules went up in 1998, and I think 1999 was the first crew. But you've got this ESA, the European Space Agency, Canadian Space Agency, the US, NASA, the Russian, the Japanese, and then some other international crew members that are sent aboard the station. So, because it is a truly international effort, consistency in how you address these kind of issues is important. I just don't have all the details for
We still don't have anyone pinging me on chat to say that they have a question, so I'm going to keep on going.
Okay.
So, yes, and does NASA have a dedicated medical department? Is there a chief officer? And
there's a chief medical officer. There's something what they call flight surgeons. So these are almost like the personal doctors of the astronaut. Not each one, but they're assigned crews, and then even the crews that aren't assigned. And so they work with the astronaut, and actually even the astronaut's family, in addressing medical issues. They're employed by NASA, so it's, I guess, one of the perks of being an astronaut. But all of their health issues while on orbit, they have private medical consultation between the flight surgeon and the crew member, in orbit, to address, it's almost like a doctor visit. I think those are scheduled maybe every 2 weeks or so with each crew member individually. And then when they're about to do go outside of the space station to do maintenance or repair or other activities outside, they go through the airlock and they put their full spacesuit on that you've probably seen pictures of. That's called extravehicular activity, EVA, and I think we have some scheduled this week, and we had some last week also. And so that you go through a decompression, and there's a specific protocol, just like for divers, that they go through before they exit the space station and after they come back. And there's a lot of medical consultation, I guess, and monitoring during that process, and the flight surgeons do that. I coordinate some talks for the NASA interns. There's interns obviously here. I'm sure you guys use interns. They come from universities all over the country. And I've been organizing different talks because they've had to go virtual versus in-person internships. And the presenter last week was the chief flight surgeon, and he kind of went into detail about all of the issues and impacts to crew from traveling in space, the effects on the bones and the muscles, the eyes, the heart, and issues related to COVID also, the precautions that I had to take to ensure that, they're protecting the crews on station.
We have a question from Candace. Go ahead, Candace.
Oh, I'll just read it out. Can you hear me, Bruce?
Yes.
Okay, great. So I don't really understand how the funding for NASA works exactly, but given I'm making the assumption that NASA gets a lot of federal funding. And if that's true, do you perceive any pressure on NASA to become more self-funding or to monetize your work or services or to commercialize them?
Yeah, that's a really good question. So NASA is a federal agency, and they're federally funded. So it's not private funding. So all of our money comes through Congress and is, negotiated between the president and Congress, what every department and agency gets for the following year. We cannot supplement that funding and that's just, I guess, the way the U.S. government operates is that government agencies, unless they're mandated to allow outside funding, they're prohibited from getting outside funding. So if I give you an example, like the National Park Service, they are allowed to collect fees for people that come onto national parks, but NASA is not exempted. So we can't take any funding from outside sources. There is kind of a nuance to that. It's called the Space Act Agreement, and that's specifically legislated and approved. And that says that we can partner with others and co-develop and get resources to do something, that meets both groups' objectives. That model, as long as NASA is a federal agency, will never change. We won't go to a model where we're like SpaceX or Boeing or Lockheed, where we go out and bid on work and get outside resources. Since we're the government, the contracting model from the old days, from 1958 when NASA was formed, was your traditional government contracting model where NASA needs a space shuttle built, and so they define what they want the space shuttle to do, the requirements of that spacecraft, and then anyone can bid, from the Lockheeds or the Boeings or anyone that has the ability to propose and bid on that work are allowed to bid on that work, and then eventually NASA will award that work with funding, the contractual agreement of how much they're going to pay for that construction. And that's how it was always done till about 10 years ago when commercial crew and cargo first was developed. And what I mean by that is, in that first model, NASA owned the vehicle. So it's our vehicle. We can contract for who helps us operate it or repairs it, or refurbishes it, but it's still our vehicle and we own it. But a shift was made about 10 years ago to allow us to leverage private sector for those services. So if you can think of, instead of contracting to build a car, you're now contracting for Uber or Lyft services. Hey, I need to go from A to B, and I'm willing to pay this much to go from A to B. And so we are contracting for crewed access to low Earth orbit, like space station, SpaceX and Boeing. SpaceX had their first manned mission. So we don't own that vehicle. We don't set the requirements for that vehicle. They can do whatever they want, but we pre-negotiated that on this schedule, on these days, we need 3 crew members or 4, or whatever the case may be, to launch from the Cape to the International Space Station, and we pay a price for each ticket that we're buying on that mission. Now you can imagine that if SpaceX got that contract to build the crewed vehicle, there's a lot of risk and not a lot of customers necessarily. It's not like Uber or Lyft where you're just unlimited, tapping into a customer base. So they needed help, seed money, to help design and develop a vehicle. And so they were given, seed money to help design and build and operate these vehicles. And that was negotiated in the price that we were willing to pay afterwards for a certain number of seats and access into space. The Boeing version of that, it's called the Starliner or the CST-100. Its first flights are going to be, I think, probably early next year. And that was another strategy of NASA, is instead of having one vehicle that if some major issue occurred and we would not have access to space and have to rely on someone else like the Russians, like we've had to for the last 9 years. we have also given Boeing seed money, and we've guaranteed so many seats over the next 5 to 10 years of when we'll need their missions. But they can turn around and find commercial use for that vehicle. So if there's commercial tourists or even commercial astronauts that get into low Earth orbit to do some useful work or research, they could sell their services to anyone that they want. So there has been a little bit of a shift in that structure of how we procure and operate our vehicles. The focus of turning over most of that to the private sector would allow NASA to better focus on exploration. I guess the thinking is that early days of and very costly days of getting access of humans or equipment into low Earth orbit are gone, and now really we need to turn the reins over to the commercial sector that can improve the safety of how we do it, reduce the cost, and reduce the turnaround. If you can kind of make an analogy to the old days of aviation, it was the private sector and the private aircraft companies that were pushing the boundaries, improving efficiency, improving safety, that allow world travel at the cost and the safety that we get today. All the government, at least on the federal U.S. side, is that they had research agencies, funded by the government, part of the government, that would help drive and improve certain technologies that were needed by the aircraft companies. And so that's kind of the thought on the space side. Now it's time to turn it over, let private sector develop and grow that, and let us worry about from getting low Earth orbit over the moon or Mars, where there's still not as much a commercial interest in developing that space. A long-winded answer. Hopefully that answered the question.
Hey, we'll give one last quick question. I'll get Anne-Marie, who's hosting this, to actually do the last question.
Okay.
Hi, John.
Hey.
Yes. Can you hear me?
Yeah. Okay.
Okay, excellent. So if an astronaut were to catch COVID-19 here on the ground, what would it take to be cleared for flight again? And have NASA's doctors come up with a criteria to recertify an astronaut?
I am 100% certain they have. I can ask Dr. Schmidt, the flight surgeon, and maybe respond back. But I would think at a very minimum, they would have to be quarantined, obviously, like everyone else, for the 14 days. And then they may be a longer duration of monitoring and retesting before they could interact with others to do all the training required to go into, on their mission. So based on when their mission is, they either will be pulled from that mission and an alternate would be substituted, or if it's enough lead time and they can get healthy and clear, they may be able to continue with their assigned mission, flight mission. For that answer your question.
That did. So I know this brings us to time. And so what I've, on behalf of the Toronto chapter of the Risk Management Association, I'd like to extend a great thanks to both you yourself, Dr. Jeevan Perera from NASA, and our facilitator, Dr. Bruce Choy from PwC. I really appreciate both your time. We know you're very busy, and we appreciate that you took an hour almost to be with us here today. I do want to conclude just by mentioning that here at the RMA, we are very excited to continue to deliver exciting and relevant virtual events in collaboration with partners such as NASA and PwC. For those not familiar with, with the RMA, it is a global risk management association, not-for-profit, member-driven professional association, serving primarily the financial service industry. Its sole purpose is to advance the use of sound risk management principles in the financial service industry. We encourage you to follow us on LinkedIn and I will post the link in the chat box below. And we thank you so much for joining us here today, and we look forward to seeing you at our next event. And thank you again to Jeevan and to Bruce for joining us today. Appreciate your time. And that concludes our formal session today. Thank you so much to everyone.
Bye. And I'll send you, Anne Marie and Bruce, the charts if you want to post it or forward on.
Thanks, everyone.
We will, and we'll post the recording. Thank you.